Well, how you doing? So now I'll be studying my ACE inhibitor and Renin inhibitors. And as you know, I'll do 30 minutes of study and 10 minutes of chat, and then we would continue from there. If you're new to the channel, please don't forget to subscribe. Let's get started. So I'll start with the ACE inhibitor. Excuse me. So let's go. Hi, Reese. How you doing? Hello, Atiyat. Thank you for joining me today. What I'm doing is studying for, you know, what exam. So I'm doing ACE inhibitor right now, and one of the medication for ACE inhibitor is lisinopril or captopril. So they are drugs that end with pril. Just wanting to know. Okay. You're new to the channel. Thank you for joining. My name is Kemi, and I'm studying for medical body exams. The first one being the renal system. So, if you would like to follow me on this journey, or you're also a student, kindly subscribe. So, I'll study for 30 minutes, after which I would come and we would have a chat. So, I might be quiet for the next couple of minutes. Prayer. So, ACE inhibitors are drugs that end in pril. Angiotensin receptor blockers end in TAN, and renin inhibitor we have aliskiren. That's the major drug. So I need to pause here and check something important. For the ACE inhibitor, um, drugs ending in green, now the first thing, and ACE inhibitors will stop the conversion of angiotensin 1 to angiotensin 2. So if that's what happens, that means there'll be a lot of renin because renin converts angiotensinogen to angiotensin 1. And when you get that exact information, don't want to mess it up. Hello, hello. Thank you for joining me today. My name is Kemi. How you are doing? And if you don't mind, let me know where you're watching from in the chat. Uh, yeah, so I found it. So angiotensinogen is converted to angiotensin 1 by renin. Then angiotensin 1 is converted to angiotensin 2 by this. It's important to know this because it will help know where each inhibitor is acting in the conversion and what it's doing, what is inhibiting. So I have it like this, so that you can see it. So angiotensinogen to angiotensin 1 is renin, and angiotensin 1 to angiotensin 2 is ACE. Okay, now that here. So if we have increased revenue, that means there will be increase angiotensin 1 that we cannot convert because we are working A's which converts 1 to 2. So when you already produce angiotensin 1, but it's not being converted to 2, so there will be increased renin, increased angiotensin 1, and decreased angiotensin 2. Makes sense to me. Right? So, angiotensin receptor blocker is okay, inhibits angiotensin 2. Okay. Okay, almost done. Okay, just a quick recap. So, we're looking at ACE inhibitors, angiotensin receptor blockers, and renin inhibitors. So, ACE inhibitors are drugs ending in pril, like lisinopril, captopril, and what they do is that they would stop the conversion of angiotensin 1, which is an inactive form of angiotensin, to angiotensin 2. They stop it. So if they stop that conversion, that means we have increased renin because renin already converted angiotensinogen to angiotensin 1. So we'll have a lot of renin, a lot of angiotensin 1, but decrease angiotensin 2 because it's not converted. And if we have decreased angiotensin 2, that means aldosterone will be reduced and so will be reabsorption of sodium. Now remember that angiotensin is the one that constricts the efferent artery. So that means we will not have constriction of the efferent artery. Therefore, the efferent artery will be dilated, and when that happens, the filtration will reduce. It also aldosterone is the one, angiotensin is the one that blocks the production of bradykinin. Bradykinin causes bronchoconstriction, like cough. So if that is blocked, that means the patient on ACE inhibitor might have to cough more often. So when do we use ACE inhibitors? In case of hypertension, in case of chronic kidney diseases, or proteinuria, even heart failure. And remember, drugs that we can use for heart failure have been proven to have mortality benefits. So, what are the adverse effects of ACE inhibitor? We already mentioned some of it, like cough and increased bradykinin, but they are contradicted in pregnant patients because they are teratogenic in nature. They can cause deformity of the features, they lead to hypertension, hyperkalemia, rash, and angioedema. Now, all these effects I just told you, like the teratonic, hypotension, hyperkalemia, rash, and angioedema, are all common to um, they are common with ACE inhibitor, renin inhibitor, and angiotensin receptor blockers. Okay, and that's the quick revision for angiotensin receptor blockers. We have drugs ending in 10, like losartan or valsartan. For renin, we have aliskiren. That's the only medication there, which is not a drug of choice for hypertension, but it also works for hypertension. And renin inhibitor would actually, renin works on converting to angiotensin 1. So if we inhibit renin, we kind of almost inhibit everything. Because now we only have a lot of angiotensinogen that is not converted to angiotensin 1, that cannot move to angiotensin 2, hence no aldosterone, hence sodium reabsorption is low. So it just kind of stops all those. Okay, yeah, so we have it. Now I'll just do a few questions and we will do some questions together after I've been able to generate a few questions. with AI. Okay, now right now I'm doing some questions, so I'm gonna mute myself. Hi, Luna. How are you doing? Thank you for joining me. So I just finished the studying. Now it's time to for us to do questions. Yeah. So just generated a few questions. Let's work on it together. So I'm also testing myself like right now, and I'll let you know if I get it or not. And for some of them, you have to tell me what the answer will be in the comment section. So let's go. 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 Okay. So, sorry. My first question. I need to drink water. Can you imagine? I can imagine the microphone amplifying the way I'm drinking water. Okay. So the first question. A 52-year-old male is diagnosed with stage 1 hypertension. His physicians decide to start him on a medication that belongs to the class of angiotensin inhibitors. Which of the following drugs fits this description? I think it's better I'm looking down than sideways. Okay, I'll do it again. A 52-year-old male is diagnosed with stage 1 hypertension. His physician decides to start him on a medication that belongs to the class of angiotensin converting. Okay, a 52-year-old male is diagnosed with stage 1 hypertension. His physician decide to start him on a medication that belongs to ACE inhibitors. Which of the following drugs fits this description? A. Lisinopril. B. Spironolactone. C. Hydrochlorothiazide. D. Losartan. And the correct answer is Lisinopril. A. I also got it right. Now we'll go to the next question. Okay, I've done mine. Now I'll read it to you. A researcher is developing a drug to block the RAAS at its very first step, especially targeting enzymes secreted by the juxtaglomerular cells. Which existing medication already performs this role as a direct renin inhibitor? A. Furosemide. B. Aliskiren. C. Mannitol. And D. Chlorothiazide. And the correct answer is B. Aliskiren. Okay. Which of the following medication provides a therapeutic effect by selectively antagonizing the AT1 receptors? that's angiotensin 1 receptors, thereby blocking the action of angiotensin 2 without affecting its synthesis. A. Valsartan. B. Amiloride. C. Metolazone. D. Bumetanide. And the right answer is A. Valsartan. A 22-year-old male is treated with valsartan. It leads to the blockage of the feedback loop, resulting in a predictable shift in blood chemistry. I'll come out it again. A 22-year-old male is being treated with valsartan, an angiotensin receptor blocker. How does this medication impact the levels of renin in the plasma? A. Renin remains unchanged. B. Renin is neutralized. C. Renin level increases. And D. Renin level decreases. And the correct answer is C. Renin levels increases. Renin level increases. A diabetic A diabetic patient is being treated with ramipril, which hemodynamic change in the glomerulus is responsible for this nephroprotective effect? A. Vasodilation of the vasa recta. B. Vasoconstriction of the efferent arteriole. C. Vasodilation of the efferent arteriole. And D. Vasoconstriction of the efferent arteriole. And the right answer is C. Vasodilation of the efferent arteriole. A patient is taking lisinopril. A patient who is taking lisinopril for hypertension develops a persistent dry, non-productive cough. This side effect is most likely caused by the accumulation of which substance? The 4A, aldosterone. B, angiotensin 1. C, bradykinin. And D, prostaglandins. And the right answer is C, bradykinin. Which of the following is considered a primary clinical indication for the use of ACE inhibitors? A. Hypertension. B. Pericarditis. C. Pneumonia. Or D. Dry cough. Let me know in the comment section. Angiotensin receptor blockers are used for the following, except A. Hypertension. B. Chronic kidney disease. C. Migraine. D. Heart failure. And the correct answer is, tell me in the comment section. In which of the following conditions are ACE inhibitors and angiotensin receptor blockers contradicted? In which of the following conditions are ACE inhibitors and angiotensin receptor blockers absolutely contradicted? A. Heart failure. B. Hypertension. C. Pregnancy. D. Chronic kidney disease. And the right answer is C. Pregnancy, because they are teratogenic in nature. Did I pronounce that right? Teratogenic. Yes, I did. Somebody's getting it now. For the following sex of laboratory investigations, okay. Time is also time just pertain to experience which of Hey everyone, thank you so much for joining me in today's live stream. This will be the end of the stream. I was going to do one more question, but the question is a little bit trickish. So that's the end. Expect the shots on all the questions we treated today and yesterday, this weekend. And I'll come back again in the afternoon or evening for another live stream. Thank you for joining me. Bye.